Hi all, welcome back to my channel. I hope you guys are doing good. Today I'm going to discuss about PEWS, that is Pediatric Early Warning Score. Let's move on to the topic. Pediatric Early Warning Score. The main purpose is to identify pediatric patients at risk for clinical deterioration. It enables the early recognition of sick patient and management of any deterioration. It's been categorized according to different age groups, that is from 0 to 11 months, 12 to 23 months, 2 to 4 years, 5 to 11 years, and more than 12 years. Today, we are going to discuss about 12 to 23 months. The main parameters are oxygen saturation, respiratory rate, heart rate, systolic blood pressure, conscious level, body temperature, and capillary refill time. As I explained before, it's been categorized based on different age groups. And now I am going to explain about 12 to 23 months. Moreover, it is not uniform universally. It may vary from hospital to hospital based on its policies and protocols. So the main parameters are oxygen saturation, any supplemental oxygen, respiratory rate, heart rate, systolic blood pressure, conscious level, body temperature, and capillary refill time. And the color codes are green means the score is 0. If yellow, the score is 1. And for red, the score is 3. So first one is oxygen saturation. If it is more than or equal to 94%, you can give a score of 0. If the oxygen saturation is between 92 to 93%, give a score of 1. If the oxygen saturation is less than or equal to 91%, then give a score of 3. The next one is any supplemental oxygen. So if the baby is on room air, give a score of 0. If the oxygen supplementation is less than 4 liters per minute, give a score of 1. If the oxygen supplementation is more than 4 liters per minute, then give a score of 3. Next one is respiratory rate per minute. So if the respiratory rate is between 25 to 39 breaths per minute, give a score of 0. If the respiratory rate is between 40 to 59 breaths per minute, give a score of 1. If the respiratory rate is more than or equal to 60 breaths per minute, give a score of 3. On the other hand, if the respiratory rate is between 20 to 24 breaths per minute, give a score of 1. If the respiratory rate is less than or equal to 19 breaths per minute, give a score of 3. The next one is heart rate per minute. If the heart rate is between 100 to 149 beats per minute, give a score of 0. If the heart rate is between 150 to 159 beats per minute, give a score of 1. If the heart rate is more than or equal to 160 beats per minute, give a score of 3. On the other hand, if the heart rate is between 80 to 99 beats per minute, give a score of 1. If the heart rate is less than or equal to 79 beats per minute, give a score of 3. Next one is systolic blood pressure. So if the systolic blood pressure is between 70 to 99, give a score of 0. If the blood pressure is between 100 to 109, then give a score of 1. If the systolic blood pressure is more than or equal to 110, give a score of 3. On the other hand, if the systolic BP is between 60 to 69, give a score of 1. If the systolic blood pressure is less than or equal to 59, then give a score of 3. Next one is conscious level. If the baby is alert, give a score of 0. If the baby is responding only to verbal or painful stimuli or unresponsive, give a score of 3. The next one is body temperature. So if the body temperature is between 36 to 37.9 degree Celsius or 96.8 to 100.22 degree Fahrenheit, you can give a score of 0. If the body temperature is more than or equal to 38 degree Celsius or more than or equal to 100.4 degree Fahrenheit, give a score of 1. On the other hand, if the body temperature is between 35 to 35.9 degrees Celsius or 95 to 96.62 degree Fahrenheit, give a score of 1. If the body temperature is less than or equal to 34.9 degree Celsius or less than or equal to 94.82 degree Fahrenheit, give a score of 3. The last one is capillary refill time. So if it is less than 2 seconds, give a score of 0. If it is between 2 to 4 seconds, give a score of 1. If it is more than 4 seconds, then give a score of 3. Respiratory distress is the another important thing we should look for whenever we are counting the respiratory rate. It's divided into mild, moderate, and severe. In mild respiratory distress, the baby will be having nasal flaring and subcostal recession. In moderate, baby will be having head bobbing, tracheal tug, intercostal recession, inspiratory or expiratory noises. If it is severe, then you can note sternal recession, grunting, exhaustion, and impending respiratory arrest. In the picture, you can see a baby in respiratory distress. So let's see about PEWS score interpretation. So if the score is 0 to 2, the baby needs 4th hourly vitals monitoring and routine resident review. If the score is between 3 to 4, the baby needs 2nd hourly vitals monitoring and frequent review by resident or PICU fellow. If the score is between 5 to 7 or more than that, the baby needs hourly vitals monitoring. Better to inform the consultant and transfer out the baby to PICU. Thank you so much for watching this video. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.